Hey guys, welcome to my channel. My name is Priscilla, and today I'd like to talk to you guys about the differences between a registered nurse, an RN, and an LPN, which is a licensed practical nurse. Now, they're both nurses, however, the degree pattern and their training may be a little bit different. Let's dive into this. So let's go. So LPN, I actually was an LPN, and I am currently an RN right now. And the only difference that I kind of really saw was the schooling. So for LPN school, I went to roughly 12 months, like 12 to 14 months of schooling, and that's including like registering for the NCLEX as well as doing my clinicals. The two programs went about it differently. One was an accelerated course and the other was kind of an accelerated course, but I didn't take it at an accelerated rate. So kind of had to stop and go for various different life circumstances. So my LPN degree and my LPN license, how did I get it? So first I started out with a quick accelerated course program. I did all the schooling, and then our very last semester, our very last cycle, we did our rotation in various different places. We actually did 2 rotation, one in the nursing home and one in more of a skilled facility where they toured us. We kind of got, we did some work, we passed out medications, took care of a couple of patients. And that was the extent of the training that I got for LPN school. They were really kind of restrictive in a sense, like they didn't want, the facility didn't want us to be, they wanted us to be there, but they kind of just wanted us to do certain things. They wanted us to do certain things, and so that's the extent of my LPN. And when I did that was the extent of my LPN. So when I did complete my clinicals, then the school helped us to, they encouraged us to do certain types of courses that'll help with passing the NCLEX and getting through the NCLEX. And that is something that really helped me personally, because the way that you do nursing school the way that you take nursing school exams isn't necessarily how you take a state board exam. And they kind of broke that down in a sense, and they told us, well, a few of the administration people, a few of the teachers told us, hey, this is a cram school. It was actually Rachel Allen, and it was a very good course. Everything that you thought you remembered in nursing school kind of just came rushing back at that course. It was really intense, and there was when they came, I actually took a day off of work just to go to that school. It was a pretty penny, but it was definitely worth it for NCLEX prep and to get me through to that state board, through my state board. So shout out to Rachel Allen. That course was it was intense, but it was really good. So after I did my cram school, I did a couple of other courses. I did Hearst as well, and then I did I always did questions, at least 100 questions a day, just until I took my state board. And as soon as I could get that state board in, as soon as I can register for my exam for my state board, I went ahead and took the exam, because I did not want to wait, because time is of the essence. When you learn these things, it's fresh in your mind, and if you wait long, or you lollygag and you sit on the knowledge that you literally paid for, it might not be easy if you wait a few months or years. So that is what I did for my LPN course. Job wise, it was fairly easy to get an LPN job for me personally, because I already had my foot in the door with a few different facilities. I was working as a home health CNA. Yeah, I was working as a CNA, and they just kind of did the on-a-job training for me. And then I went from my CNA job to LPN, and they kind of did over the course of 6 months. After I passed my NCLEX and stuff like that, they kind of just mentored me and put me into that LPN role, and that was that. I didn't go into the hospital with the LPN, with my LPN license, only because I needed to work a certain shift, and I needed to I kind of needed to have a laid back type of flexible work schedule, and the job that I was working helped and worked and was flexible in that sense. So next I'm going to move on to my RN degree and how I obtained that. So my RN degree was kind of like, it was a very, very long process for me. Not that long, but it was quite extensive because, I mean, obviously I'm in the military and I've got different things that I've got to do, because when you sign a government contract, they kind of own your schedule, and they kind of own certain things that you do. You gotta go. So I was doing that, and while I was in the military, and the schedules kind of clashed at times. However, going through the programs a little bit different. Every semester we did go into a clinical site. We went to skilled facilities, nursing homes. We went to the hospital, med surg, pediatrics. We did labor and delivery. We shadowed in peds and neonatal and peds ICU, excuse me. And then we also did the ICUs as well. So they were very, very thorough in how they trained us and had a purpose to what we were going to be doing. And that's usually what the RN degree, if you're going to get a bachelor degree, or even getting an associate of arts, or not associate of art, ADN, associate of nursing, associate degree of nursing. So if you're going to be doing that route, they're really extensive. Every program is different. You can't go into one program and graduate with another program. So it's kind of just, it's kind of intense. It's kind of intense in a sense, like if you're going to start with one program, you have to try and complete that program to the end. So that's why I didn't try and switch programs. And I didn't try and do a million different things, just because that's just how it is. Obviously, it's different in every area, but mostly that's the name of the game with nursing. If you start a program, they will not take credits from other degrees, or from it would not take credit for other nursing programs, because they cannot guarantee that that nursing program taught you that specific rubric or that specific skill, because they have a certain standard that they need to abide by, which is completely valid, completely understandable. And also that's kind of why nursing can be, in certain programs it's more flexible, certain programs it's not. But it's pretty rigid. However, certain programs like the LPN program, in a matter of 12 months, I was able to complete that, and worked with the school, going to different places and going to different facilities. So, really, really be cognizant about the program that you're going into, and doing that. So my school for RN school, they had a ATI, that was the service that they had that kind of worked us through every single course, from fundamentals of nursing to medical surgical nursing. We had to take a comprehensive test every single semester for ATI, so that we can reach comprehensive abilities, and then be able to pass the NCLEX. And so our very last semester, we took the comprehensive ATI course, which was kind of like a cram school, like your Hearst or your Rachel Allen, where we kind of just did questions and went over certain test questions and testing styles for the NCLEX. It was kind of helpful. However, it didn't really refresh our memories. It just taught us how to look for the correct answers and how to answer questions during the NCLEX. So it was helpful in that area. If you're not a really good test taker, it kind of really helped you prepare for that. However, I like to know the reasoning behind things, and I like to get like a refresher of all the things that I learned, because it had been like 3 years, a span of 3 years in which I was doing this nursing program, and I don't think I remember. I mean, I remembered stuff, but you're not going to remember the details of the course that you took like for your first semester of nursing. But I digress. They did help us get through that. Once I got a day that I could, the day that I could schedule my NCLEX, I did not wait to take my NCLEX. I did not wait because I've seen it where people have waited and you lose confidence, you lose knowledge sometimes. And I was already a nurse then. I just wanted to get my RN degree, and you know, there's a really good pay boost between LPN and RN, and I could work in the hospital, which I ended up doing. I actually had a job. I had a job already, so I really just wanted to pass my NCLEX. And we completed the ATI as a class, and then we did the ATI. After I finished the ATI, I actually went to a cram school the semester prior, did Hearst review through another college. It was like $200 or something like that. I don't recall the prices. I don't know what the prices are now. I did Kaplan. I also did UWorld, which they had a bunch of questions, and the goal for those questions were that you pass 70% or 80% of those questions correctly before you take the NCLEX. So my goal was to complete UWorld, do all these courses, complete UWorld, and focus on the questions that I did not get correctly. UWorld had about like, I don't know, 1,000, 2,000 questions. And from the span that I graduate nursing school to like, it was a matter of like 30 days or something like that. I graduated in December, and in January I had scheduled myself to take the test. And so I completed like 1,500, 2,000 questions of UWorld, and then after that I drove out of state to do my test, because it would be a lot faster then. And I did that and then passed it. Once I passed it, pay the money that you needed to pay just so I could know in advance, and that's it. For the main differences, comparing and contrasting LPN versus RN, you kind of want to know what the type of program you're going into. If it's a program where they're going to hold your hand and they're going to help you out, which is fine. Some people like that, some people don't. But you have to learn how you study, and you have to know how well your program will prepare you for the NCLEX. So I think that's the minimal thing that you need to know. And final notes, obviously there's a pay difference between LPN and RN. I would say If you are an LPN, you can work in the hospitals. You might have to get a little bit more certifications. You might have to do certain things. You might have programs that you need to do while you're in your hospital system. But it's definitely doable. If you already got your foot in the door as a CNA or tech, that's definitely doable. However, you might as well just go and get your RN degree. But I just wanted to get my foot in the door. I wanted to get something under my belt and do nursing, because I am in the military, and you don't know what's gonna happen next. So I was like, you know what? I just need to get this LPN degree under my belt and then work on my RN degree as well. I just wanted to start working as soon as possible. And I also learned through on the job, and you just learn stuff differently. And that's just how I did it. You make your decisions and you do so if you please. But that's kind of like my take on LPN versus RN. Obviously, initially there could be a pay difference, but there are some LPNs that are making really good money out there. So don't let anyone tell you that it's just, I mean, don't make it be all about the money. However, just understand that depending on what you do, what area you're in, you can still make quite a bit of money as an LPN and as an RN, because if you're working a bunch of shifts, you're not telling me anything. As an LPN, you can make some money. So obviously it's not about the money, but we got bills to pay. So anyways, guys, thank you for watching. If you guys have any more questions about LPN versus RN, nursing school, please let me know. Have a great day. Bye.